The basal ganglia, the spasticity of hypertonicity that frequently occurs with cerebral palsy in the premature infant results from concomitant hypoxic ischemic injury to the basal ganglia. One major function of the basal ganglia is to inhibit muscle tone throughout the body by transmitting inhibitory signals to both the motor cortex and to the brain stem. Basal ganglia are also responsible for initiating intentional gross motor activities, which in turn are fine-tuned by the cerebral cortex. If the hypoxic ischemic injury primarily involves the basal ganglion and spares the cerebral cortex, choreiform, athetoid, or ballistic movements will be the predominant abnormalities seen over time. The onset of these unintentional, uncontrollable, purposeless movements generally is not clinically apparent until after 1 year of age. This makes the prognostication for neonatologists challenging because the baby, while under our care in the NICU, may not be exhibiting any of these motor signs, but these become more apparent with age. Hypoxic injury to the cerebellum is less common in asphyxiated premature infants. It causes diminished capacity for smooth, cooperative, sequential action between muscle groups. Clinical manifestations may not become evident until the child is older and exhibits more complicated motor movements. Motor disabilities associated with cerebellar damage: number one, a complex motor movement appearing as a sequence of irregular, disjointed movements, also known as cogwheeling, a staggering ataxic gait with a tendency to fall, an intention tremor which intensifies as the movement nears completion, and then finally a loss of control of the range of movement, resulting in undershoot or overshoot of the final target.